Hi, everybody. My name is Joan Nagelkirk, and I'm the Executive Chairperson of the McKenzie Foundation. I'll be serving as the moderator for today's Town Hall event. We're holding these events for our community members, and we're so glad to have you with us. I'll start by asking each of our panelists to tell a little bit about themselves. Dr. Hammond?
Hi, my name is Mark Hammond. I'm the Medical Director of the Emergency Department in the Hospitals Group at McKenzie Health System. Also the Medical Director of 8 counties, including Sanilac, Tuscola, Lapeer, Huron, and 4 Northern Michigan counties.
Steve Barnett?
Hi, my name's Steve Barnett. I'm the President and CEO for McKenzie Health System, which is a hospital located right here in Sandusky, Michigan.
Thanks. Bryant Wilke?
Good afternoon. I'm Bryant Wilke. I'm the Health Officer and Environmental Health Services Director for the Sanilac County Health Department.
Duane Lange?
Good afternoon. I'm Duane Lange, Superintendent of Sanilac Intermediate School District.
And Dr. Gormley? Dr. Gormley?
Hi, Matt Gormley, pediatrician and internist with McKenzie Health System.
Okay, great. Thanks so much. So just a couple of housekeeping items, and then we'll launch into our topics for today. First of all, your audio is automatically muted. So you can use the question and answer function at the bottom of your screen to ask a question. The town hall will be recorded and a link will be sent in a follow-up email. So if we run over during our question and answer period at the end, feel free to jump off the webinar and then you can watch the recording at your convenience. The topics of our agenda today are updates for our community, heading back to school, part 2, keeping our kids safe and healthy, and the questions and answers. Dr. Hammond will kick us off by sharing updates for the community. Dr.
Morning, everybody. Good afternoon. So as many of you know, COVID-19 is a virus that's easily transmitted through respiratory droplets, secretions, coughing primarily. As a state, we're doing a really good job compared to how we were back in March, April, and May. We're one of the better states on the national level as well. We endured that shutdown, and now we're reopening up our economy, and now comes reopening schools as well. So we currently don't have a virus, but there are a couple companies who are producing vaccines that are crossing the finish line with a goal date of sometime end of the year, early next year. There is no cure for coronavirus currently, for COVID-19 currently, but there are medications that can help reduce how sick you may get with it, and also some medications that have been shown to help improve the survival of people who get very sick with coronavirus 19. And then I'll be here for any questions you might have.
Okay, and Steve?
Yes, thanks, Joan. I'll keep my comments brief because I want to make sure others have time to share their remarks. And of course, we want to allow for questions today from any listeners. McKenzie Health System is here today to support the return of school challenge we're all facing. As a hospital member of the Sanilac County Emergency Operations Committee, McKenzie Health System has been engaged throughout the pandemic with local and county officials as we all try to mitigate the spread of COVID-19. McKenzie Health System has been able to maintain a safe environment while testing and treating patients throughout the pandemic, and we will continue to share our best practices as we have with others as we take on this new challenge of opening the schools safely. McKenzie has also been able to secure equipment that allows us to offer rapid COVID-19 results. However, securing supplies to support the equipment continues to be difficult. We are, however, able to commit, and we have, some of our supplies to instances where it has been determined that a rapid result would help guide further decision-making in the schools. And I think our goal is a shared goal of everyone on the call today, and that's let's keep the schools safe and let's open them.
Thanks so much, Steve. Bryant?
Thank you. Just to kind of underline a little bit what Dr. Hammett's mentioned and Steve, and also explore a little bit of the numbers that we're seeing. Statewide, we've seen 99,200 cases with 6,424 deaths. As compared to our locality here in Sanilac County, we've had 118 cases. We've only seen 5 deaths. Well, I correct myself. We've seen 5 deaths up until yesterday. We had our 6th death, which our heart goes out to that family and our condolences. But you can see with the numbers, and as well as if you look at the statewide database, you'll see numbers associated with higher cases surrounding our county. And I think Doc may talk about that a little bit better, a little bit later. So within our county, we've done pretty darn well. There's some contributing factors we think that's causing that, and that was our long-term care facilities, our jail. They either were prepared or they really ramped up really quick back in March and became prepared. So we didn't have a lot of congregate cases that came up. Also, our jail, as I mentioned, and also just the community as a group, we really came together for the most part that allowed us to be where we are today. So we're here today, I think, to reach out to the schools and the parents about to re-engage in school to kind of get acclimated to this in the future, because we need your help and to continue to protect our community. Regards to testing in the future, we're always going to provide testing, I believe, but we've had 8,582 tests completed on individuals that live in Sanilac County. Now, that's not the health department's testing, that's the big conglomerate testing. When we look at that testing and the positive rates, we're seeing about 2 to 2.8% positive rates. We want to be 3 or below. So we're sitting pretty, close to 3, but it's coming down. And we really want to get that number below 1. And just to offer up really quick, the things that we can do to stop this immediately is wear our mask, maintain 6 foot from one another, and use sanitary hygiene and alcohol wipes on our hands and hand sanitizers, excuse me. So out to those folks that are preparing to come to school, for those parents, you'll see a lot of information, and we'll have a parent toolkit on our website within the next 24 hours. Screen your children at home. Make sure that you're not sending them to school sick. And we want them fever-free 24 hours if they have been sick, and have them have a mask, but make sure you're cleaning that mask every day. So you're sending that child off to school with a clean mask. So we'll take questions later, and thank you for my time.
Okay, thank you, Bryant. Dr. Gormley.
I always got to remember to unmute this thing, sorry. So I'm talking a little bit about the COVID-19 and the kids, as well as the multi-system inflammatory syndrome. So to give you guys a little bit of background, some studies are showing that about 2 to 5% of the positive cases are in pediatric population. Typically, they seem to have a less severe reaction than adults, but the interesting thing is they primarily get it from adults. Age groups typically are about 1/3 as far as under age 1, 1/3 are from age 1 to 10, and then another 1/3 10 and above as far as our school age kids. Symptoms kind of vary, but fever and cough seem to be the most common. If you're under 10, a little bit of runny nose and shortness of breath seem to be a little more common symptoms versus the older kids, headaches, muscle aches, along with the shortness of breath. But we don't see as common the GI symptoms like vomiting, diarrhea. They can occur, but some of those respiratory symptoms seem to be a little more common. Very typical to your cold symptoms, and that's probably going to lead to some frustration as well as extra work for us this fall. Fortunately, only about 2-3% of those pediatric population require a hospitalization. And most of them have underlying health conditions. That happens about 15 to 20% of the time. Most common are chronic lung disease, such as asthma, congenital heart disease, diabetes is another common factor, as well as immune compromised states, including obesity and smoking, interestingly. Most of these kids recover within a couple of weeks if they're in the more asymptomatic or mild symptom brackets. And fortunately, death rates seem to be on the lower side, but unfortunately, kids are still passing to this as well. You know, in comparison to the MIS, most of those kids are presenting with GI symptoms, as I was alluding to a little bit ago. And that's kind of interesting. The big thing there is a persistent fever of, 4 to 6, 3 to 5 days. And so the other interesting thing about this syndrome is that it seems to be more of a late complication, not with an acute affection of COVID, but popping up a week or two after there's been exposure or COVID symptoms. And again, abdominal pain, vomiting, diarrhea, those seem to be more of the common symptoms with the multi-system inflammatory syndrome. Respiratory symptoms can happen, but they seem to be a little less common. And again, interestingly, the severe respiratory symptoms seem to be even less. MIS is a pretty rare complication, but it is on the uptick, and that's the reason why we need to be able to track this as well as the COVID itself. And this seems to be a bigger problem within the pediatric population. It's interesting because, there's some theory as to maybe it's related to a less severe immune response, but we don't know all the exact details. And it is similar to Kawasaki syndrome or Kawasaki disease. You may have heard that in the news as well. The other component that I wanted to kind of talk briefly about, excuse me, is just the stress response in general at this time. Overall concern, I think, is up. The trend or the rates as far as anxiety, depression, and even suicide are up, especially in our adolescent populations, with isolation, things like that. There was a recent survey that mentioned even upwards of 13% of all Americans have considered suicide in the last 3 months. That's a big number. You're talking about 40 million people. So we just want to make sure that we're having those conversations as healthcare providers, as teachers and school administrators, as well as parents at home, to make sure that we're not missing any additional things that could be contributing to other health concerns. And just real quick, there's been talk about, well, what should we be doing? Should kids be coming into the office? The answer is yes, really. If you look at a lot of the CDC and AAP guidelines, we need to be keeping kids up on their preventative care visits, their immunizations especially. And so we want to make sure that we're passing that message along as well. Hopefully, we'll be able to continue to do a good job of this with the telemedicine involved as well, to be able to help parents and get kids seen that need to be seen. Thanks, Joe.
Yeah, great. Thanks so much, Dr. Gormley. At this point, we're going to start the question and answer period. And remember, if you have a question, just type it into the Q&A function at the bottom of your screen. Oh, sorry, Duane. Duane, help me. Duane, go ahead. We want Duane in here.
From a school standpoint, all of the 7 local districts and the intermediate school district had to file return to school plans. They should be posted on each individual district's website. Those plans have a lot of similarities, but yet are specific to the individual districts and geographic locations also. The goal of these plans are to minimize the risk of contracting and or spreading the virus, obviously keeping our students and staff safe. They include procedures, processes that we've implemented. Some were in place prior, majority are new things, cleaning processes, stuff like that, once again, to minimize that risk. Recently, you've seen in the paper as of yesterday that 5 of the districts have delayed the start of school for a week. And the reason for that is because there's been some questions on that is everybody has implemented online curriculum virtual platforms, and working with these companies, they were just bombarded. So the issue with getting their platform, their virtual platforms and their virtual curriculums in place took a great deal of training, and it was very difficult getting that training for our staff. So that's the reason 5 of the 7 districts backed it off to make sure that they were prepared for the start of the school year. Depending on the district, we're running between 20 and 30% of the students in each district are opting for a virtual option, at least to start the school year. Different districts have different timelines when students can jump back and forth if they want the virtual versus the face-to-face as the school year goes on. So that's kind of an overview of right now where we're at. And I will be answering obviously some of the questions that are in the question queue also.
Yes, we're already getting questions for you, Duane, here.
Thanks.
So now we will be starting the question and answer period, and be sure to submit your questions through the Q&A function at the bottom of your screen. And I'll start with the first one is, I noticed the number of COVID cases are increasing. In fact, by 7 to 9 within 1 week with an additional death. The new guidelines for indoor facilities are recommending circulation of fresh air for enclosed buildings. How are the schools going to accommodate this? Duane.
Well, I think it's going to go back to our plans, implementing our plans, and do what we can do during the 6-7 hour days that we do have children and staff in. But some of our concerns is some of the behaviors of students outside of the school day, some of the get-togethers outside of the school days. So that may carry over into our schools. A lot of it's going to have to do with communication, working with our parents, making sure that parents are keeping kids home that have symptoms or may be exposed to COVID situations, and also communicating with us. And it's important that we continue to communicate across the county. As superintendents, we communicate regularly. As of recently, we've developed a good rapport with the local medical people, several that are on today's call. In fact, we had to implement some things last night, and we appreciate some of the responses that were received back specifically from Dr. Hammond last night.
Okay. The next one, also for Duane, is, in addition, mask wearing is not consistent in the area. How are you going to get more people to wear the masks appropriately and not below the nose? Well, that could be for more than just Duane, but I think she's talking specifically about schools.
Yeah, it's gonna. I guess at the career center level, I go back to wearing safety glasses. You know, that's been the old thing, making sure kids are wearing safety glasses all the time and wearing them correctly. It's just going to carry over to the mask and getting in the habit of wearing masks. You know, first day we'll be greeting kids getting off buses, making sure, especially at the career center, making sure they have masks, making sure they wear them. Administratively, we're always in the classrooms a lot, working with teachers. We emphasize, because we have our staff in this week, emphasizing with them the importance of it. And it's basically for everybody's safety. So hopefully we get to a more of a routine, and it's a normal thing for them.
And so it sounds like you're going to be modeling that, wearing them correctly, right? And then helping the kids adjust to that.
Yes.
Right? Okay. Another one, I recently saw on the news that Heartland schools just opened last week and shut down yesterday. Will a consistent testing site and procedure be available to the students in the schools?
I can answer a little bit, but this may go to the medical field. I know we've received information this week from the medical professionals as well as guidelines. And, you know, as far as closing down schools, that's probably going to be on an individual basis. If we have an outbreak in an individual school, or if it's in an area, it could be as a county, or it could come from the governor as far as a shutdown. You know, right now our county is pretty good as far as the number of cases compared to some other areas or some other regions. But that's where we're going to rely heavily on the advice from the medical professionals in that area on what to do, what's the best for our kids and staff.
Does anybody else from the panel want to take a stab at that answer too? Consistent testing site and procedure available to students in the schools?
Joan, this is Steve. I can add a little bit there, but I think Bryant and Dr. Hammond could certainly add more in terms of the backdrop, what's going on behind the scenes. I think should be somewhat comforting in that Superintendents have access to public health. Public health is triaging incoming questions and concerns that they may have. And then Dr. Hammond can step in and be contacted and play a role in defining the urgency. And if testing is something that needs to be done urgently and as a high priority, then we at McKenzie have set aside some of our supplies so that we can manage those testing components as they come in. But I would defer beyond that to Bryant or Dr. Hammond.
Thanks, Steve. Yep. So as Steve mentioned, McKenzie does have the capability to do what they call the rapid testing. Now, just so you know, these aren't the rapid ID tests where they come back in 15 minutes. These come back within about an hour or so. And the results are about 95% to 99% accurate. Unlike some of the ones you hear about where there's a lot of false negatives and unsure about results, the rapid testing we have at McKenzie is top of the line, actually. It checks for not only coronavirus, it checks for 21 other viruses as well, including influenza, RSV, and a lot of these childhood viruses that you might see on a typical day. So we did reserve some criteria for who would be eligible for a test and why, and what kind of exposure. And then for those that don't meet the criteria for that rapid testing, we have the routine nasal swabs that we do send out, which can take a few days to get back. So again, we set aside those rapid testing, which are limited supplies, for those more situations where a test would make a difference of what would happen tomorrow at school versus what would happen in 10 days. So we kind of have these internal criteria we have to follow, a checklist we follow to make sure we're testing appropriately so we're not wasting resources.
Okay, thanks. Bryant, do you have anything to add? You're muted, Bryant.
Sorry about that. Yes, just to add to that and complementary to what McKenzie's doing, the Sanilac County Health Department provides testing on Tuesday and Thursdays. It's a drive-through testing. It's done between 9 and 11 o'clock. All you have to do is call our testing line and make an appointment. There's no cost. We will bill your insurance, but there's no deductible or copay or anything like that that's taken out of that. So testing is available. So if you do have a student or one of your loved ones that you feel needs to be tested, you can call in and get that arranged. Now, the other thing we'll be working on, both Dr. Hammond and my communicable disease nurses, along with the superintendents of the schools, if we do have a positive or if we do have a sick child and we suspect COVID, we will be working with you, the school, and the parent on determining what we need to do next. Should we get tested? Is there's some history there with health conditions, allergies, and things like that. And then we'll sort out what testing you need to go to, as well as working with, if that test comes back positive, do we have contacts that that individual had during the school day, whether it's on a bus or in school. And then we'll be working, trying to get that cohort engaged and communicate with them whether they need to be tested or quarantined or isolated throughout this school year.
Okay, thank you. Next question is for Duane initially too. If a school has a staff member or student who finds out after school that they have been exposed, what do you recommend we do to protect our staff and students prior to the start of the next day of school?
If it's a parent situation, I would contact, if you can't get hold of the local superintendent, that building administrator being the principal, and kind of a procedure. And we actually sampled this last night. A phone call came to me from one of the local superintendents. We discussed it. He had identified all the information, where the contacts were, where they weren't. And then we proceeded, got a hold of the medical professionals, and we got advice from them to see the severity of the risk. And then we would proceed in whatever situation may be, contacting staff, contacting additional parents where that was in close contact. But our first step is to gather as much information we can about the whereabouts of that student or staff during that prior day or whenever. Who did they come in contact with? And then when we go from there, working with the hospital, we have a hotline that we can use 24/7. So we have access to some medical advice as far as what process we should use. And also between the superintendents, we communicate regularly because when we share kids through the Career Center, and you've got kids intermixing in the community. So that's important too, that we keep neighboring districts aware.
Great, thank you.
Joan,
Yeah.
I'd like, I just want to add on. I think what Duane just described, I can't overstate the fact that the level of communication and the coordination between these stakeholders, is really at a very high level. And I think Dr. Hammond may even comment when he's on his public health medical director calls, when you query others around the state, what we've set up here is pretty exquisite and pretty thorough, and I think it gives us the best chance. And I'm not sure that anybody else is doing the same thing.
You're right, Steve, they're not doing it. So I am in contact with the other medical directors throughout the state, and I asked about, if they're doing anything like what we're doing at McKenzie and Sanilac County as far as the testing goes for risk staff or scenarios, and nobody else is. So we have a benefit of being able to offer this to the school system to really, hopefully put out fires before they start and to help keep the schools open. So I think we're in a really good position, really good place, and it's going to take a lot of modeling by parents at home. Even if, you political, I don't look at a mask as being political. I look at it as being a mask, right? So if you're not a fan of a mask, we want the kids to wear the mask at school for those that have to. So I would just kind of encourage them to wear the mask at home or around if they're going out. And by speaking positive about the mask, about how it helps prevent coronavirus, it's going to help increase the use of the mask by children at school. And again, we don't have a cure. We don't have a vaccine yet. All we can do is prevent this virus from coming out in the first place. And this is our best means of prevention, either this or staying home or shutting down. I think all of us want to go back to school, and my kids need to go back to school, please. So we need to wear these masks.
Okay,
Joan,
thanks.
if I can jump in real quick too.
Sure.
Just to kind of piggyback off of that, I agree with what Dr. Hammond was saying, and especially it's going to be crucial that parents are helping out the school districts, essentially. If your kiddo is sick, you got to let them know, and they've got to stay home. You can't be sending them to school this year with any type of cold symptoms. It just can't happen.
Okay, Joanne, I just want to really emphasize what Matt just said. It's so important. We raise kids from the community aspect, and this is a great example. We have to come together as a community and realize that when we send kids off to school sick, no matter what kind of virus it is, we're spreading germs, we're spreading viruses, people are going to get ill. So it's very important that we as a community work together, work with the schools, work with our medical community, work as a health department to keep our numbers down and keep the kids safe at schools. And it's just so important that we engage. And we've been doing this, and I was a little bit remiss earlier that we have an emergency operations center that's been active since March. And we've been communicating on this weekly several times, these folks on the Zoom meeting right now as we speak. And a shout out to Todd Hillman for his efforts in keeping us on point and in focus to get where we're at today. And it can work in the schools if we all hang together and do this the right way. So that's it. Thank you.
Great. Thanks so much. Our next question has to do with masks too. What are the procedures for special needs children who can't wear masks? Duane?
Yeah, at our Maple Valley Elementary School, due to the nature of the students' disabilities, as well as the age of the students, masks will not be required of students. Optional if students and parents feel that they can wear those. But several of our students, due to their disabilities, would not be able to remove a mask, so we're sticking with the guidelines there. Staff and anybody involved in that building will still be wearing masks. If we do have some, and I've got two that I'm aware of at present time, Career Center students due to some asthmatic situation, they have received doctors a note that they cannot wear the mask, but in both those cases, they've agreed to wear shields, the face shields that that we have when we have those available. We've purchased several of those as well as different type of masks. So we're hoping that something will work for those students too. But it will not be required of the younger special needs students.
Okay, good. Thank you.
And Joan, that's actually in compliance with what the AAP is recommending as well. Just wanted to comment that on Duane's.
Okay, so the face shields,
As
using
far
that.
as, no, as far as for the special need children who may not be able to tolerate it,
Okay.
the biggest thing there is they're really going to recommend trying to keep them distanced at that 6-foot distance to help the spread there.
All right, anyone else? Okay, this is an interesting question. Are there extra supplies for low-income families, such as masks, thermometers?
You know, I know from a school standpoint, when the COVID hit back in March, we depleted all of our stock. I think it went to mostly McKenzie, Marlette Hospital, and Autumnwood. They had the request, so we depleted our stock, but we were able to order stuff early. And we have a great deal of masks. I think we had 20,000 masks, 10,000 for students, 10,000 for staff. We've got some other things. We've got some face shields, you know, so we would be willing to work with some parents. And I know most of the local districts have right now a pretty good stockpile of PPE equipment. So if you're in a situation where you cannot afford the mask, you need stuff, contact your local district, contact the ISD, and we'll set you up from our standpoint.
Okay, nice.
Joanne, I just wanted to mention there is a statewide supply of masks available. The state purchased, I think, up to 500,000 masks to be distributed to low-income folks. I don't know what those distribution centers are yet, but if anybody has a question or a need on that, if they want to give us a call or an email at the health department, we'll be happy to find that out for them.
Okay, that's good to know. So just email or call the health department about that supply.
Yes.
Okay, good. Here's another one. Are you concerned about all the excessive use of antibacterial soap? Also, as a parent, I feel kids should be able to take a break from masks once they are at their seats because I'm concerned about all the bacteria that they will be breathing in all day. Will teachers and staff accommodate that in a positive way? So maybe we'll split that up a little bit. First of all, are you concerned about all the excessive use of antibacterial soap?
What
Maybe
comment?
the doctors?
Sure. I don't think the amount of antibacterial ingredients are not enough to cause resistance at this point. And again, you could use any kind of soap. It doesn't have to be antibacterial soap, but any kind of soap will do as long as you wash with warm water for 20 seconds or sing your alphabet song or whatever song you want to sing for 20 seconds. Dr. Gormley has some songs too, I'm sure. But I'm not really worried about the type of soap, and resistance, you know, with a short amount of time using it, it should be fine. Now, outside of medication that you're ingesting, where you have to worry about long-term resistance, but you see less of that with topical use.
Okay, all right. And then what about the question of giving them a break, kids a break from masks once they're at their seats because this person is concerned about all the bacteria they will be breathing in all day? Duane, maybe, or I don't know for sure.
I know, and that's a tough one because you're still in a confined classroom. I know some of the district have been talking about exchange class times where they go outside for a brief period, some of that nature, and that's kind of a local district decision. A lot of that has to do with the makeup of their buildings and their facilities. But the big thing there is the concern with when you're in that enclosed classroom, the masks need to be on according to the guidelines.
Okay.
I'm not going to chime in. You know, there are some cases, surgical cases, where surgical staff and healthcare providers are in an operating room for 8 hours at a time with the same mask on, and they're just fine. So a kid wearing a mask for a couple hours at a time, you know, shouldn't be an issue as far as, you know, retaining bacteria. And plus the amount of bacteria that you're really going to, it hasn't been known to cause a health problem at this point. None of the data shows that it's a high risk. Now, if you have a dirty mask or a soiled mask, get a new mask, you know. Otherwise, if you have a clean mask on, just wear that mask and you should be fine.
Okay, anyone else?
Hey, Joan, real quick, just so people are aware too, you know, soap and water is actually the preferred method of hand washing. Now, obviously, we're encouraging all the hand sanitizers as well. and that's fine, but people should be feeling comfortable as far as washing their hands with soap and water. And yes, the ABCs will work just fine, Dr. Hammond.
It's great to know. Good. All right, on to another one. This is specifically for Duane. What's your plan as far as the tots and teens class and having the 3-4-year-olds to have a mask on all day? And what will happen when none of those kids keep it on?
Those are good questions.
Yes, they are.
Our teens program is part of our careers in education class. So there's high school students in there for those that are not aware of it. It's basically a 3-room classroom. So with, the one classroom area is more for the direct instruction for the juniors and seniors. So say half of those students would be working in there with the teacher. It's a two adult program, and the other ones would be in the room working with the young children. We've reduced the numbers of young children that were preschoolers that we're having at a time. We are not requiring masks of the 3- and 4-year-olds at this time. The adults as well as the high school students in that room will be wearing masks. But the room is split up, and we can divide them pretty good, divide and conquer as far as not having them real close together. Also knowing they're 3- and 4-year-olds, they're going to want to be together. So, and as long as the weather's nice, they'll be outside quite a bit. We have a fenced-in playground in the backyard. But we have reduced the number of students that we're taking at one time.
Okay, thanks for that. As medical professionals, if a 4-year-old keeps dropping their masks and then putting them back on their face, isn't that worse? And maybe we already addressed that, Duane, with your last one, that they're not required, but in general, perhaps. And maybe for the little masks, littles, masks shouldn't be required, but I think we've answered that in the school. They're not going to be.
Not in our 3- and 4-year-old program. If a parent wants their child to wear a mask and they're willing to do that, we're fine with that also, but it's not going to be a requirement.
Okay.
Joan, I think also the state recommendation is that it's 5th grade on down, if I remember correctly, is not required to wear it, but I could be wrong on that statement now.
Does anyone else have any input on that? No? Okay. Okay, if a teacher notices a child is sick in their class, when should we send them to the quarantine room as compared to how we handled sick students in the past? We may have some, go ahead.
Yeah, it's each district have identified quarantine rooms. You know, in the past, they'd come down the office and sit in the outer office usually till their bus went back or till we got someone to pick them up. That the child needs to immediately go down to the office area or the quarantine area, and then parents will be, or legal guardians, whoever they may be, will be required to pick them up. Students will not be transported back on buses. They'll have to stay there till they get picked up, and then those quarantine rooms will be appropriately disinfected.
All right, so this same person we may have some parents who may not want their kid going to the quarantine room if the student just has allergies, has asthma, and a cough, or something else that also qualifies as a COVID symptom. So is there a designated area? Did you just say that in your answer?
Well, we have, specifically at the Career Center situation, we have several outer offices here that we can use. So it may not necessarily be the same room. I can't speak to the local districts because it's going to be the makeup of their offices or areas. I know a couple of the districts have freed up vacant classrooms that are close to the office where they can subdivide those. So it may not be in the specific area as quarantines.
Okay.
And that'll be on a case-by-case basis.
You know, in that question, the person asked about asthma and a cough. Just have asthma and a cough. But that might be a COVID symptom. So we don't know if it's a cough due to asthma, cough due to, whatever, or due to COVID. So that's where and that wouldn't be asymptomatic. So that would actually be symptomatic. So that's where we have to be really careful about, in this day and age, what looks like a normal cough, a runny nose, like an allergy that people get year-round. It might be COVID, it might not be. We don't know until we actually get tested. So that's why we have to have the extra precaution. That's why these things come in handy, because we don't know if it's my daughter's runny nose or if she has COVID and she's gonna get me sick. So we don't know.
Excellent point.
And I also think that that's why it's going to be important to stay in touch with your healthcare provider to make sure, because that question brings up a great point. There are going to be a lot of allergies flaring up in the fall season and everything else. So you do need to make sure that you're, again, getting that routine care for your kid and staying on top of those medical conditions as well.
All right.
Joanne, I just wanted to kind of stretch this answer out just a little bit further. And I get a little bit of sense of, I remember when I was in school and got sent down to the detention room, right? I won't tell you how many times, but the stigmatism of being sent down to the quarantine room or the medical room can too take a toll on a child and parents and everyone else. So we have to be really aware of that we don't want to stigmatize people with, oh, they've got COVID, our school's going to close, and the rumor mill growing so big. That's why we got this plan together, and we're communicating that we can find out, well, okay, is this student just normally experiencing these issues every year, or do we have something we need to do to make sure it's not COVID and protect everyone else? But that stigmatism, the bullyingism that can come from this, we really, as a community and parents, have to be aware of it and try to stamp that down as much as we can as we move forward.
Excellent. Anyone else? All right, then on to the next one. We have this question. How safe are the students when they're not wearing masks and not able to maintain 6-foot distancing while in the classroom, an individual cohort of students?
I'm assuming this question is for like elementary children where it's not required up through 5th grade. And I think there it's going to come down to that social distancing. And yeah, our elementary classrooms are small, 900,000 square feet, is a typical room. But there, I believe, and the medical people can answer this more, but there I believe it's important that, because it's going to be hard to get the children to keep them on. The hand washing, the getting in the routine of that, whether it be the disinfectant by the door, whether it be the hand washing, and covering their mouth, and not sharing utensils or supplies is a big thing of that also.
Okay. What about the asymptomatic COVID-19 individual? If you do not have symptoms, how do you control a situation with the children who cannot wear masks? Studies show face shields are not as good at protecting the individual due to small particles in the air.
Social distancing, the 6 feet distancing works. It helps minimize the risk of transmission. And then if that kid can't wear a mask, it's going to be extra important that others around that kid wear a mask, And again, so the mask isn't more for your protection, to prevent you from getting COVID. It's to help prevent transmission of COVID from somebody who already has it and is asymptomatic. So you have better chance of not getting COVID if the person around you who might have COVID not knowing it, who has a mask on. So the masks work in multiple ways, but it's a defensive mechanism as well as a preventative mechanism. And we just have to ensure if we can't get that 6 feet distancing in or some kind of protective barrier in place, plexiglass, whatever it is, we have to really encourage mask use. It's going to be a hard thing to maintain, but we have to do our best to make sure it happens.
Mm-hmm. Okay, thank you. Here's a question about COVID, getting it again. Can children get COVID after they've had it once?
I'll jump on this one. So we currently don't know for sure, right? So this is a fairly new illness. It's been around for at least 6 to 7 months that we know of, maybe longer. So there hasn't been enough time to study to see if it's possible to become reinfected. Now, there was a case somewhere where a gentleman is thought to have reinfected after 4.5 months of having it. But that's a case that was very rare. But we'll know more for sure towards the end of the year or early next year as far as how long you would have some kind of protection after you get COVID, where you can't get it again, or for how long would your immune system say, okay, I'm immune for X amount of time until this wears off, then I get COVID again. We don't know for sure, but that's why, wearing a mask and preventing the transmission is going to be so important to help minimize that risk of it happening until we get a solid vaccine in place to help prevent this from coming out in the first place.
All right, thank you. And do you agree with the recent CDC recommendations stating that asymptomatic people should not be tested even when exposed?
I'll get on this one too. So CDC gives recommendations. Any good clinician will look for evidence behind the recommendation because we don't follow things blindly. So that's such a new recommendation. There's a lot of controversy in the medical field about whether it's something that we should follow or not because the evidence isn't really there to support it at this point. So you're going to look at news articles and news reports and look at the whole political side. And to me, that's a lot of fluff that I don't really pay attention to. I look at the medical part of it, the data behind it. And at this point, the CDC made a recommendation. And I could tell you right now, I was on a call earlier, the medical experts are actively discussing that recommendation to see whether or not it's something we should follow or not, and to what degree and how. So again, the recommendation was made, but I don't think it's going to be widely implemented yet because of the data behind it to support that decision. So, but we will not hesitate to, once we see data that works, to explain why, because it's a big difference from what we were doing for the past 6 months to what they recommend us doing now. So we want to see why the change in recommendations and how can we explain it to the patients too, instead of just adopting something blindly. What can we use to help support that decision making? So, but in the meantime, I would assume, you know, until we kind of decide either way, I would still stick to the current, well, the way that we already know has helped prevent transmission in the first place is if you're exposed to somebody for at least 15 minutes, not continuously, it could be all at one time or it could be throughout the day, and we're within 6 feet, or we're coughed on, or any kind of close exposure, you're considered a close contact. So in that case, I would want that person who was a close contact to quarantine, not being around other people in case they might have it. And then the question about getting tested. And here's where it gets a little bit tricky. So you could have been exposed to COVID 10 minutes ago and be tested in 5 minutes, and the test will look normal, will look negative. You could be tested every day for 10 days and I'll make it look negative, but the 11th day, you could suddenly show up as being positive on the test. So currently, we can't give you a good time frame of when to get tested and when not to get tested, but we do know it could take up to 14 days, usually up to 10 days, 12 days, but in some cases up to 14 days for a test to show positive, and that person can be contagious. Even though they might have to have symptoms, they can be contagious. And again, I could be somebody without symptoms and be around somebody who's very ill, who has chronic conditions, and I could get them very sick. So even though I'm asymptomatic without symptoms, I can get somebody sick and they can have severe symptoms and even risk death if there's somebody who's very ill. So again, the CDC recommendation, we're really studying it, we're really debating it. I can see by the end of the week or maybe early next week some clear guidance about how to follow that. But it's definitely something to pay attention to. And we'll let you know as soon as we know.
And Joan, this is Steve. The question of someone being asymptomatic and a parent being concerned, you know, at the end of the day, I think every parent's concerns need to be shared with whomever their primary care provider is. If they have a question, that's who they should be calling and getting some guidance from them. I think over time, as kids are going to school, coming home, and we're able to, through this high level of communication and pathways that we've set up between public health and the superintendents across the county, I think over time we're going to see just how successful that is. And I suspect that we're going to see a confidence level rise, not only among the school system and the teachers, but also public health and just our general sense that we've been able to continue to do a good job. But whenever there's a question, I think a parent needs to call their primary care provider and get some clarification.
All right, that's good.
Yeah, I think that's really, I think that's really good advice, Steve. The other thing too is, as Dr. Hammond was saying, you know, there's a lot more factors that go into this. Is this patient that we're talking about immunocompetent? Are they immunocompromised? So there's other variables as well. And that's why I think it's going to be a little bit of time before we can uptake maybe that recommendation and go from there.
All right. We have a question here about what the messaging will be to parents in the community if there is a positive case at a school. Who will be notified and how?
The process that we've discussed, that we put in place basically for all 7 local districts as well as the ISD, is once we get the information, what we know about the situation, who they were in contact with, we consult with the medical experts, and then we will make contact. The local districts will be the ones that are contacting any families, any staff, and the parents of kids, or in some cases, if they're 18 years old, the kids themselves, and let them know their status, whether it's an alert, whether it's they need to be quarantined, depending on the specific, how close they were to the person for how long, based on the medical recommendations. So yeah, we just confirmed that yesterday, and working with the medical people, that the local districts will be the ones that will be contacting individual contacts to parents. Parents also need to realize we can't mention names with that because of confidentiality. It'll just be stated that there was either a suspected or a positive COVID case that your child may be exposed to, and here's the situation.
All right.
Joanne, I just want to emphasize what Duane said. If you have a positive test and you've had close contacts, those contacts will be contacted. They will have some communication, either both through the school and the health department, to determine whether you need to be quarantined or isolated. So the key is out to the public and to the parents and teachers is that if you have been exposed, you will be contacted. So for instance, we have an exposure at one of our local schools and you haven't heard from anybody, but you know there's something going on, you can rest assured those individuals have been contacted that have been exposed.
So either by the school or the health department, or both?
Well, more than likely both, because I think the school is going to verify the contacts. And then if we need to do any contact tracing on any of those individuals that have come in direct contact with that positive individual, we will be talking with them and isolating them and giving them instructions. And then we also follow up on all these individuals throughout their 14-day quarantine period.
The reporting of a positive case will come by the health department on the daily reports. Is that correct?
Yeah.
That is correct, I believe, correct?
Yes. We'll report out positive cases within our jurisdiction for any schools. Yes.
But we're not going to say the school's name, correct? No school name.
Nope, just that we have positives in the school within Sanilac County jurisdiction, but those individuals within that school who've been contacted will know they've been exposed in some type of activity, whether they're quarantined or isolated, depending on the scenario that we're dealing with.
Social media is going to blow up with, I saw this person with a cough or runny nose or that. So it's important that everybody know that the messaging is going to be a unified message from the health department and the schools, what you need to know. So if your child was exposed, you will know. You'll be contacted and you will know your child was exposed. If your child wasn't exposed, you guys will not be contacted. So the messaging is going to be absolutely important. Check out the health department's messaging, the school's messaging. It's going to be a unified message. This way we keep the information accurate and keep the rumor mill down to a minimum, hopefully.
I will add to that. It's very important for us and parents to know that Dr. Hammond and our communicable disease nurses and myself, and with consultation of others on this panel, we'll work through the scenario that is given to us, whether the person was positive and who those close contacts were. You may have had a child and find out they were in the same room, but based on our evaluation of risk, we may say that was a secondary contact and that individual can go to school. They don't need to be quarantined. They don't need to be tested at this time. Of course, we all need to know that we need to monitor our kids for any type of symptoms all the time. So once they develop something you should contact the school. But keep in mind, we are doing a bunch of work in the background, if I may say it that way, to isolate who we need to really hone in on and either isolate or quarantine and get tested at that point in time.
This isn't a question in the queue, but I've seen this online. People are wondering how they would know if a person from the health department is calling them. For myself, I don't answer phone numbers I don't recognize. And so would you leave a message then, or how does that work?
Yes, we would leave a message. And I think there's been some statewide ads on that because they've found that when we do contact tracing, it may come up as a government number or some other odd number, and you don't know that, so you don't really want to respond to it. So we're encouraging people, answer that phone. It might be somebody calling from the health department. Typically our ID says health department,
Okay.
but it might be a private line or one of our business line cell phones. It doesn't display who it is, but pick it up, distinguish who it is. And if it's the health department, please stay on the phone and talk to us. We just want some details so we can get eliminate risk from the kids and the parents and get sorted out that who are those contacts and what we need to do with them to get them better.
All right, thank you. We have a couple more questions and a couple more minutes to go. Here's one. Is there data that masks prevent COVID? And if so, can we share a link? One of the doctors, perhaps?
Sure, yeah. There is data out there, and I could send a link to this group currently. Absolutely.
Okay, so we could send a link out when we send a link to the recording, right?
Yep.
Okay, good. And then, so a person can be asymptomatic, have negative test results, and still be contagious? I think you're muted, Dr. Hammond.
Sorry, I thought it was too easy to answer though. So great question, very good question, a very relevant question too. So this is why the whole, if you're exposed, if you're a close contact, you're exposed, why it's so important to quarantine. Because yes, you could absolutely have COVID and be contagious without having symptoms. And the test result, sometimes the test result, even if you're contagious, it might be negative for the first few days of that level. So that's why that's why we call these people super spreaders, because they walk around all day, feel absolutely fine, get tested negative for COVID because the test result hasn't shown up as being positive yet. We think that's probably due to the viral load picked up in that sample, or maybe in the test reagent itself. And those tests are not 100% accurate. That's why you have to remember that, talking about how 95% accurate test, 95 to 99% is a really good number. But some of the tests out there are as low as 80%. So 80% false negative, 80% accuracy rate, sensitive rate. So you could actually have some people walking around with a false negative test where the viral load wasn't sufficient enough to register or whatnot, and they could be contagious. So that's why it's so important that if you have symptoms, number one, if you have symptoms of cough, runny nose, a fever, these things, let your primary care provider know, let the school know, stay home, or at least kind of get advice on what to do. However, if you were told that your child was exposed or was a close contact, that's why it's going to be so important to keep them home for the duration of time that's recommended. And then, even though the CDC says don't get tested if you're asymptomatic, currently say that, we want to say that don't get tested right away if you're exposed because it might look negative. The test might be more positive towards the end of that 10 to 14 day mark. But at the same time, there's a great question because you could still be contagious and have a negative test result. Your risk of being contagious is a lot higher if you were exposed to somebody who had COVID-19. However, if you're just, if you've been at home for a month and you haven't been exposed to anybody at all, you have a runny nose, it's probably not COVID-19. However, but we just don't know if those exposures, those close contacts, if they're walking around asymptomatic or not, and like it's actually contagious. So that's why the testing isn't perfect. It's pretty good what we offer at McKenzie, but it's not 100% perfect. It's a lot better than other ones that we offer throughout the area. However, just the guidance says exposed, quarantine, assume you might, assume you have it. If you were exposed to somebody, assume you have it until they can prove you don't have it, if that makes any sense. And if you have any questions at all, call your primary care provider, call the health department, ask questions. Googling is fine, but sometimes you find the wrong answers in Google. That's why asking a human being who knows would probably be more accurate. So, but that's a really good question. And it's going to come up very frequently, I bet.
We've had a couple more questions come in, so I think we'll go a little bit yet. This is a good one. What is the difference between isolate and quarantine? Is there any difference? Maybe Bryant?
Sure. A quarantine is when we suspect somebody's been exposed. So we immediately quarantine those. So those individuals will not expose anybody else. Now that individual is on a 14-day quarantine, means that we're waiting to see if they're going to develop any symptoms. And that's Doc was indicating, you want to wait 4, 5, 6 days if you feel like you need to get tested. But even though you're quarantined, you get tested, comes back negative, we're going to maintain that quarantine out that 14 days. Isolation is when we know for sure you're positive and we isolate you away from everybody, so that because you're under a medical care isolation. And I'm sure any of the 2 docs we have can probably clarify that anymore if it needs to be.
Well, Joan, this is Steve. I would piggyback onto what Brian said, not only now, but also previously, because I think it is of value. On the isolation piece, when somebody presents at McKenzie, for example, if they are communicating to the provider who's all gowned up that they have symptoms that are consistent with COVID, we don't even let them in the facility. We walk them around the building and bring them in at a separate entrance into one of our 4 negative pressure rooms. So those really do isolate not only the individual, but any cross-contamination. So that's, and we do that until we can get a result back that tells us whether they're positive or negative. And what we found is that ability to isolate in those negative pressure rooms is a huge asset that we have when we're trying to protect everyone else who may be in the hospital. Bryant made a previous, and you had asked about it, Joan, in terms of reporting and picking up your phone, even if you don't identify the number. I think, the message that needs to get out to the community is that if ever there was a time to begin to talk together, communicate, don't worry about what it is you think you may have. This is a time when we need to come together and really be thinking about one another and being respectful of what you may be doing if you don't communicate the conditions accurately to those that are inquiring and trying to contact trace. So this isn't disciplinary. There's nothing negative about it. It's just trying to make sure that we're controlling the spread of this highly contagious disease.
All right, thanks, Steve. Here's a good one. True or false? If any 2 people anywhere in Sanilac County become COVID positive, and these individuals are affiliated in any way with the schools from staff to student, all schools in Sanilac County will be closed. This was said by a neighboring county school administrator, so this person that's the reason this person is asking this question.
I guess my answer to that would be false. For the simple reason, we got to find out where those kids were, trace where those kids were, who they came in contact with, and then based on that information and the advice from the medical professionals, that's when we'd make a decision. Is it a classroom? Is it a school? Is it a bus? What it is.
All right, so that would not automatically, all the schools in Sanilac County would be closed then.
No, because with that scenario, I can't see us staying open very long.
Mm-hmm. All right, and then this is for you too, Duane. It's my understanding that CDC has air filtration specific recommendations for schools. MERV 13 air filters, perhaps. Are the schools in Sanilac County in compliance with this? And then there's a website attached.
At the ISD, we do not have any at present time. I'm not sure what local districts have done.
Okay. And I think our last question then is back for Dr. Hammond or Steve would be, are there false positives as well? So Dr. Hammond, you were talking about the false negatives. Are there false positives as well?
They're a lot less likely than false negatives, however.
Okay. Okay, then I think we've come to the end of our questions. And I'd like to thank our panelists for your time today. We really appreciate it, as well as each of the people who have participated in this town hall. The next town hall event will take place on September 16th at noon. And the topic at that time will be healthy ways to deal with stress, which we're all feeling these days for sure. Please watch your email for the invitations. And this concludes today's town hall. Thank you again for joining us. We appreciate it very much. And we hope you found the information helpful. Bye-bye.